Good afternoon to everyone on the land of Zoom, and welcome to the Board of Health virtual meeting on Tuesday, March 26th, scheduled for 3:30. My name is Thomas Corey. Present with me via Zoom is Michael Coughlin, Dr. Stephen Gagliardi, and Tess Curran, our agent of the board, various guests and participants in today's meeting. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting and may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. Tess, can we have a roll call?
Thomas Corey,
Present?
Michael Coughlin,
Here.
Stephen Gagliardi.
Here.
Next item of business is the approval of the minutes of the meeting from Thursday, February 20th. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed?
Move to
No,
approve.
motion, second,
Tess, can we have a call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes.
Stephen Gagliardi.
yes,
Next item is the request for variance for the keeping of chickens by Joaquim Dias at 1144 Mariano Bishop Boulevard. This one we've been dealing with for some months. Faust, are you presenting on this one?
I am. I was gonna pick one of the chickens to help, but it's passed away. It's been so long. We've inspected the yard a couple of times. I was the last one to inspect. It's a nice big yard. It's the coop is in the rear of the property. It abuts another lot that the Dias own. It's pretty much out of the way, and all the paperwork's excuse me. All the paperwork is in order. It's a nice, clean, neat yard, and I see no problems.
Okay, they've got their rodent contract.
They do.
How many, is there anyone here from the family?
Yes. Liliana Dias is here. I'm sorry, probably.
Oh, okay. That's is with you. Okay. How many chickens are they requesting?
12.
12 chickens. We know the rule about no roosters.
We do.
Okay.
That was discussed.
And we already have we have the rodent contract, 12 chickens, no roosters.
Correct.
Any questions, gentlemen?
no, sounds good,
And looks good from your point of view, Faust?
Oh yes, an exemplary setup, I'd say.
Okay. Can we have a
All right,
motion?
motion to approve,
Second.
Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Yes.
Stephen Gagliardi.
yes,
Okay, good luck with the chickens. Thank you for your patience in this matter.
Thank you.
Okay.
Thank you.
The next item is a tobacco violations hearing, a first offense of an act to modernize tobacco control by 7 at 1641 South Main Street in Fall River. Jennifer, you're presenting?
Yes. So on February 7th, I completed a round of compliance checks. At approximately 11:52 a.m., my youth buyer went into 7 and she was able to purchase a 5-pack of Backwoods cigars for $7.99 using a $20 bill. No ID and no age was asked. Immediate following the check, I tracked it in my system. Since it was their first violation of the state law, a fine was issued for $1,000. At this time, the payment is due and the retailer is looking to appeal a violation.
what's the
Jessica.
basis for appeal?
This is,
That's me. Hi,
hello,
how are you?
we're fine.
I'm sorry, I really don't know how this works. This is the first time I've had to do this before, so basically I'm not fighting, I'm not disagreeing with what happened. I remember the whole transaction. So I do apologize for that. It's not something that I would do intentionally. I understand that I didn't ask for ID We are a brand new store. We opened up in November. We don't have a lot of customers right now, so we're very slow, and we actually really can't afford a fine at all, especially $1,000. So like I said, I'm not fighting that I didn't do it. I'm not saying I didn't do that. It's more just I just want to appeal in hopes that we can get a second chance, maybe like a warning or something like that, instead of the hefty fine.
Okay, I don't think we have much leeway in forgiving or appealing fines. The state law says the first offense is $1,000 fine. When you get to the second and third offenses, that's when the board can act, because our responsibility or our obligation is a suspension of the permit. Is that correct, Jennifer?
Yes.
Okay, so there's really, the fine is due. And we hopefully we will never see you again, okay? Because the next time it'll be a $2,000 fine, and we are obligated to suspend the permit for 7 days.
Okay.
Gentlemen, any questions, any comments?
No.
Okay, so I'm sorry, Jessica. I wish you luck. I hope you get some more customers, but be very careful and check the IDs.
Thank you.
Okay. Do we need any further action on that, Tess?
Sorry, just thinking. I think we could make, if someone could make a motion,
Denying the
follow-
appeal, to deny the appeal?
yes.
I move we deny the appeal.
Second.
Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
Thank you. The next item is the tobacco violation hearings, a second offense, an act to modernize tobacco control from Stop and Save at 345 Robeson Street here in Fall River. And Jennifer, you're presenting again.
Okay, so on the same day, on February 7th, when I was doing compliance checks at approximately 12:40, my youth buyer went into Stop and Save, and she was successfully able to purchase a single backwoods cigar for $1.86. No ID and no age was asked. As soon as she left, I tracked it in my database. The state law mandates that it's a $2,000 fine for a second violation. A fine was issued for $2,000 and a possible suspension for up to 7 days. The retailer did issue their payment on February 28th for the $2,000. Prior history shows that within the 36 months, the first violation took place on November 7th, 2021, and that was also for selling to a minor.
Sir, please identify yourself with your name and address for the record.
Yes, my name is Abraham Badad. I'm a managing partner on the Stop and Save. Okay, we're not disputing as well. Yes, our employee did sold that. Only thing, I don't have any further documentation like we have received the last time, so we can take some kind of action on our employee. He's claiming he didn't do it, but he must have done it when you have all this documentation. So we have prevented this, post new signs, age signs and calendar, and retrain them as well. And this employee is no longer with us anymore.
Okay. Well, it's important to train all your employees and to reinforce that training every 6 months, every year, whatever you find necessary. Okay. The $2,000 fine stands because that's what the state law reads. And traditionally, the board has issued a 7-day suspension of the permit. Gentlemen, what are your feelings?
And they seem to have taken some substantial remedial action. I don't know if that holds any weight, but retraining and posting and firing the employee, I don't know. What do you think?
No, we haven't waived the suspension in any of the cases that have come before the board since I joined, but it's only been a few.
Mhm.
You know, I'm open to it.
Open
mean,
to
the-
waiving the suspension or not waiving the suspension?
Open to waiving it, but waiting to hear what your opinion is.
What's the penalty for third violation?
Oh, for the
3,000.
third, 3,000. Oh, I'm sorry.
And up to a 30-day suspension.
So, I mean, I'd be open to waiving the suspension, but on a third violation.
You can count on the 30 days if it happens again.
Yeah,
Okay, can we have a motion to just the fine? How do we want to word this properly?
motion to waive the suspension, but keep the fine.
Second,
Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
yes.
Stephen Gagliardi.
Yes.
Sir, you are a very lucky man today.
Thank
Now,
you.
you will be retested shortly and several times during the next year.
Mhm.
So make sure that the employees are trained, the
Yeah.
signage is up,
Mhm.
and if you come before us again, it will be the state requires the $3,000 fine, and we will enforce the 30-day permit suspension.
Again, thank you.
Yeah.
Okay,
I'll
good,
try
good
our-
luck.
we'll-
Good luck with the training.
Okay.
Hire good employees.
Yes. Okay.
All right.
Okay. So,
Jennifer, thank you very much.
Thank you.
so I'm free. We're free to exit out this meeting.
Yes, yes, sir.
Thank you, sir. Thank you all again. Bye.
Tess, what do we have for the director's report?
Sure. So we are continuing our efforts in terms of the opioid settlement funds. And last week, the health department released a community-wide survey that we've been pushing out to community partners. We've reached out to the school systems, everybody within the network that we have here in the health department to help promote the survey. What we're looking for is the community to, anybody who lives or works or goes to school or is a community member or has ties to Fall River to complete the survey. And that will help guide the use of the opioid settlement funds. So we're looking for particularly folks with lived experience, lived or living experience, people who have an unstable housing situation. We want their input through this process. So we're, again, working with community partners who have clients or work with folks who, identify as one of those individuals to complete the survey. So it's been live for a week now. The survey will be open through May 5th.
Okay, how do I received an email and I did the survey already. How does the average person listening to this, how do they obtain access to the survey?
So it is on the Fall River website. So fallriverma.gov. If you scroll about halfway down the first page, you'll see an icon for the opioids settlement fund survey. It's also been posted on the City of Fall River's Facebook page and is pinned to that page. So if people go and visit the City of Fall River Facebook page, then you'll be able to find that as a pinned icon again on the top of that page.
Very good.
And we are disseminating posters throughout the community. There's posters with QR codes that are being shared, so people have easy access to the survey. Additionally, people can reach out to the health department, and we can provide folks with a link via email if that's an easier option for people. But we have received just under 200 responses within the week that it's been open. So we were pleased with that response rate so far. But again, are really hoping to engage with specific populations to hear their perspective and where they feel as though the money should be allocated. So this will be one tool for review as those funds begin to be disseminated through an RFP process.
And how much money is involved over how many years?
So we have estimates that we'll be getting just shy of $8 million over the next 15 years. Right now, we have just shy of $2 million. To date, we received some additional funds on the 15th. And so we've received more recently. So far, the funds have been spent on a strategic plan and support with the RFP process that is currently being developed.
Okay, very
Most
good.
most of the money is front loaded in the early years of the settlement. That's why we already have 2 million in the bank. It'll go down pretty dramatically as in the coming years.
Mhm.
Yeah, the
Okay.
other thing I was thinking, based on Tom's original question, is that the survey went out to a number of the community organizations that provide services to the community with lived experience, and the expectation is that they'll share the survey with some of those folks, and we'll get their input that way. Back when I was the director, we had a community newspaper that would be happy to, run a nice article about something like this and give it the attention, but we really don't have that available to us these days. You don't still do that radio program with your colleague, your pharmacist colleague, do you, Tom?
No, we stopped just before COVID started.
Okay, yeah.
I do have some plans for some radio programs and some other opportunities for broader promotion outside of the community-based organization. So I'll be doing that in the near term.
Okay, very good. Anything else?
That's all I had for today.
How's the new software training coming?
The teams have been trained. They are still kind of working out some of the kinks, just getting used to the new software. But everybody has been trained, and they're ready to take it into the field when they feel that they're comfortable with the program. So we're in good shape there, and again are looking forward to having that data on hand. But yes, everybody has been trained. The food inspectors and sanitation minimum housing group has been trained. So we're excited about that opportunity.
Very good. Did anything come in for citizens input?
I didn't know. We have no citizens input.
Is there anything else of such a matter that it could make the agenda?
Nothing else.
Okay, gentlemen, we got to set the next meeting. Following our usual procedure, there are 5 Tuesdays in April. Would you like the 23rd or the 30th? Anyone have a preference?
23rd looks good.
23rd looks good.
That's
Tess, that
fine.
good with you?
Yes, that's fine with me.
Okay, 23rd for everybody. That's all right. If there's no other business, can we have a motion to adjourn?
So moved.
Second,
Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
Okay, thank you all. Thank you, Sandy and Alex. Have a wonderful Easter weekend. Don't forget to eat lots of eggs.
Have a good weekend.
Thank
So
you.
long. Thank you.
Bye.